Welcome to the Center for Ambulatory Surgery, where taking care of you is personal to us. The Center for Ambulatory Surgery is the premier provider of outpatient surgical services to the Western New York region. Our commitment to superior clinical outcomes, safety, and convenience make the center an excellent alternative to traditional surgical settings for patients and physicians alike. The purpose of this video is to help you prepare for your visit by providing you with a virtual tour of our facilities. In this video, you will view our facilities and become familiar with our center. At the center, we believe that patients who are prepared will have a better experience. Research has shown that there is a higher level of patient assurance, less stress, and less anxiety when patients are prepared for surgery. The Center for Ambulatory Surgery is located at 550 Orchard Park Road in West Seneca, New York. If you have any questions about how to find the center, please contact our staff for directions at 677-4400. Once you have arrived at the center, there are several parking options. Patients should park behind Building B, which is the surgery building, or Building A, which is for the GI unit. Once you have found a parking spot, you will enter the building and make a right into admissions. For the GI unit, you will park behind Building A and enter the building and make a right into admissions. At registration, patients will be greeted by our courteous receptionist who will ask you for a few specific items. Remember to please bring your photo ID, insurance card, required paperwork, and copay. At this time, the staff member will verify personal information on your admissions forms and obtain your consent on necessary paperwork. Patients will also be asked for your driver's name and relationship. Drivers are asked to stay for the duration of the procedure. Patients will receive their ID bracelets and then stay in the waiting room until the pre-op nurse comes to get you. One of our nurses will meet you in the waiting room and bring you to the pre-op area. At this time, she will check your name, date of birth, doctor, and procedure. The pre-consent and consent to transfer medical records will also be signed at this time. Your procedure will then be explained, and the nurse will be available for any questions you might have. The nurse will review your medical history and physical, medication list, and any allergies or reactions you might have. If you're having a colonoscopy, your bowel prep will be reviewed at this time as well. The nurse will then complete her review, including when you last had anything to eat or drink. You will then be put on a patient gown and lie on a cart. An IV will be started, the side rails will be put up, you will be given a call light, and will be ready to go into the procedure room. When everything is ready, a nurse will wheel you into the procedure room. Once again, a timeout will be performed by the nurse, confirming your identity, procedure, doctor, date of birth, and any allergies. Upon the completion of your procedure, you will be hooked up to a monitor for 30 minutes. The procedure nurse will give a report about your recovery to your recovery room nurse. If you had a colonoscopy, passing gas is a required part of your recovery. After 20 minutes, your vitals will be checked, and if you are stable and can sit up, you will be given some juice. At this time, your ride home will be brought into the recovery room to wait with you. Next, the doctor will come and review the procedure with you and discharge you. When you are able to be discharged, Your IV will be removed, and you will be assisted into a chair to change back into your original clothes. After receiving your discharge instructions from the nurse, she will then wheel you in a wheelchair out to your car. We look forward to treating you at the Center for Ambulatory Surgery, where taking care of you is personal to us.